When I'm looking at someone's squat pattern in the clinic, one of the first things that often comes up with people is a concern about hip tuck or butt wink. And where one of the things I'm going to check on that is the adductor magnus and its ability to extend and lengthen under load. The reason for the importance of this is adductor magnus attaches from the femur just above the knee to the pelvis, where it's attaching on the ischial tuberosity, so the same point of attachment as the hamstrings, and onto the pubis as well. And it's through the attachment, especially on the ischial tuberosity, whereby it can influence hip tuck. If it's not lengthening well, then it can create this posterior tilt and spinal flexion as a result of how it's going to affect the position of the pelvis on that attachment. So it's going to cause it to basically come from this position. So if it's attaching here and it's not going to lengthen, it will pull so that the pelvis tilts posteriorly. So we might use one or two manual therapy interventions to help correct this. We'll take these and as fast as I can, I'm going to get you up off the table. Once we've done that, I'm going to reassess the squat pattern again and see how that has changed. Are you now squatting with reduced butt wink, or are you squatting deeper before it happens? And then we're also going to look at what it looks like under load. So quite handy that we've got the rehab space downstairs, so we can get you under a barbell straight away and have a look at it again. This time we can put, it doesn't need to be a heavy load on, but just some weight on your back, and that way we can see how you're changing the position and how that affects it. Sometimes simply just making good cueing whilst you're squatting can just reinforce this, maintaining a good position. But another one that I like to use are lateral lunges, in terms of how this really works and trains adductor magnus and the adductors in general. But for our purposes, in terms of what we're talking about today, really getting that to work hard eccentrically as you're going over the leg that you're loading. It teaches it to lengthen well, so you're really reinforcing this the movement pattern, which carries over well into the squat. There are other things that can influence just what your squat looks like, obviously. Everything from morphology of the hip. Not everybody has a hip that allows you to look like a Chinese weightlifter when you squat. But we all want to squat well if it's something that we're going to be using in the gym. So this is how one of the things I look at when we're addressing, let's say, the hip tuck problem that you can experience when you're squatting. Other things that we want to look at are just how well you brace through your torso. That in itself can create a big change. Just learning to brace properly, and therefore keeping a nice upright torso, is going to create better range of movement through your hips, and that can eliminate some of it as well. But as I say, for the day, one of the things that your takeaway from today could be that the use of lateral lunges, especially in warm-ups, can work wonders in terms of helping improve your squat positioning over time.